Hi all, welcome again to my health and wellness channel. So today's topic is on health insurance. Um, Talking briefly about health insurance, as we all know, health insurance is kind of as of now it's a prerequisite. If you actually go and visit an European country or probably US, so in most of the European country, health insurance is compulsory. Even to enter in European country, more or less you need health insurance. So if you plan to stay long term in the long term in any European country, you definitely need a health insurance. You have different, of course, modes of it. Most of the people go with public health insurance, but you have private health insurance as well. Now, in India, I have seen of late people are becoming more and more conscious about health insurance and taking. A lot of people are taking health insurance, but if I talk about a product in India, life insurance was much more common product, and people used to think life insurance is more of as an investment, right? I have not seen many people picking up life insurance as more of a kind of a term insurance, more often as an investment, right? What I understand is, and what my opinion is, health insurance is way more important than life insurance, right? In life insurance, your beneficiary gets money when you die or something happens to you, but what about a serious health issue? All your savings or your family savings or your parents savings, everything goes off, washes off in just a matter of few months, right? So it's very important, and if you see really health, the expenditures in hospitals are really day by day increasing. So there are different forms of health insurance. You can take individual health insurance, you have family floater in health insurance. So we'll discuss in detail about each and every aspects of health insurance. But what I can tell you for sure is it's you have seen COVID, right? How much big impact it has actually made to everyone's life. Suddenly, a lot of people lost their lives, and so health insurance, is really prerequisite now. We all understand this at least now. So I'll go through in this blog. I'll explain in details what are the different kinds of health insurance, which one is good for you, which one you should take, and latest developments coming in health insurance, especially specifically to Indian market. I'll talk about more on this. Yeah. Hi Debrati, how are you?
I'm fine. How are you?
I'm good. I'm good. So today I thought of talking more about health insurance, right? You have you heard about health insurance?
Yes, I heard about the health insurance. It's a one kind of the policy.
Yes.
So you have to pay, suppose first year 10,000, 20,000. So, and after that, they will give you a card. So if you go to the hospital, so some policies and some instructions are there. So if these things are under belongs to some instructions, they will reimburse our money or they will give cashless policies there. So up to 5 lakh and 10 lakhs, such kind of the policies are there. So if you go to the hospital and so if you are hospitalized and the total billing amount is the 2 lakh or 3 lakh, they will give the that total amount 2 lakh or 3 lakh, but you have to book for this 10,000, 20,000 like that.
So you do you have health insurance policy?
So I have health insurance, 3 years health insurance policy is there.
Your age, I'm sure you will be like somewhere around 30s, right?
Yes.
So,
Right.
why do you think at such an early age you need a health insurance?
Actually, before that, if you take health insurance more after 40, so yeah, it is fine. But earlier, so the old people, suppose or grandfather and father, they are not suffering from any big diseases. But nowadays, as our life changes and the culture and environment, everything is changed, right? So due to this, so we are suffering from some diseases because these diseases, they are not, our grandparents, they are not suffering from those diseases. Okay, so because we are eating some kind of the fast food and something, but earlier they are not eating like this kind of the foods. So nowadays we think that, so if you not more than 40 but not below 20 or more than 20, so if you create a health insurance in between 30 to 35, so it is fine.
Okay, so you consider this important, right?
Nowadays it is important.
No, I think it was always important in English, but yeah, people have got more serious because of I think COVID-19 and stuff. People think
Yes.
if you see in Europe, it was always very important. In India, the culture has started right now, or maybe a few years back, when people think
It is
seriously.
important.
So right, you would have. I think what I remember is we have taken a policy together,
Yes.
right? So even also my mom has a policy. So she thinks, my mom thinks this is a waste of money at times. So initially, first time she told me it's a waste of money. I asked her why. She said, you know what, beta, we used to invest in life insurance. It's an investment kind of a thing. You know, nothing happens to you. You get the money back. Like get certain amount of money back. But let me tell you about health insurance policies in general. You don't get any money back.
Actually, in daily, if we see our daily life and day to day, anything, we can give money in different way, different places and different way. Okay, why not if we book a one health insurance by giving 10,000, 20,000, it will secure our life and our health. Okay, we don't know what will happen today or tomorrow. Okay, anything can happen with us and for our parents also. Okay, diabetes issues, sugar issue, that is the common issues, and kidney stone. These are the common issues are there. So better if you book one health insurance
As early as possible.
as early as possible.
Okay.
Because we are giving money anywhere. So,
Anyway, I mean, anyway you go and spend in a fast food, why don't you something spend on your good health?
to secure our health.
Right. So I think that is one thing which all of us understand now. It's not there are different kinds of policy, of course. One is individual policy which you take for a person or as a couple, but there are the senior citizens. So like because my mom is about 60, not about 60, closer to 60, I have a different policy for her because it's senior kind of senior policy. So premium little higher for her because so it's always good to start as early as possible, right? Because there is saying health is wealth, right? So if we have if you take care of our health, that is most important, right? And a kind of life which you have fast moving life, lot of pollution, a lot of things are happening. So and also nowadays, you have a lot of wellness programs. These companies tie up with a lot of wellness sites where you take references, you get gym membership, your premiums will get little lower. So what I want to understand from you, considering everything, of course you have taken, I know that you have taken a 3 years policy. So would you like to continue this for the rest of your life? Do you think this is an investment? Do you think?
This is not a kind of investment, but to secure our life and our health. This is the one.
So this is one of the investment you can say, right? I mean, you invest on gold.
My health.
You invest on health, right? So that is, I think, it's a great thought which you have. I think I hope everyone also.
So everyone should take.
Right.
Everyone should take such kind of the.
Actually, it's more than money. It's the safety. It's the feeling of safety that okay, something happens to me, at least I have insurance to support me, right?
Yes.
That is something.
Anything can happen.
Right.
I don't know.
Thanks a lot for your views. We'll continue. Thanks a lot.
Thank you.
So now you would have seen the kind of discussions we had. Me and Debrati discussed on what is the thoughts on health insurance. As you know, health insurance is a very important product. It's probably one of the first thing you should think of. Just getting your first salary, this is something you should be thinking of, right? Before making any other kind of investment. As I say in the last portion, also health is wealth, right? So if you go by the Niti Aayog report of 2021, so it says around 30%, it's around 42 crores of Indian population don't have health insurance. I believe the numbers will be much higher, right? So but I think what actually has shaped up the importance of COVID insurance in India is because of, I think, COVID-19. That has shown us how important it is to have a health insurance policy, right? So just to talk about the kinds of policies you have individual policy, you have family floater policy, senior citizen policy, and some of the health policies also take care of maternity maternity things, right? So yes, we have a family floater. I mean, we don't have kind of my mom has separate seniors kind of senior different policy because her premium little higher, and my wife has a different policy, right? And we have a multi-year policy. So multi-year policy has its own advantages, right? I mean, you usually would see that roughly 15% or 10 to 15% premiums are lower if you take 3 years policies, right? And also if you think, right, the medical expenses are getting higher day by day. So most likely if you take a multi-year policy, so as the medical expenses increase, insurance premiums also generally increase, right? So if you take a multi-year policy, that helps you to kind of that takes care of the increase in the the incremental prices, right? So another advantage is also you get tax saving. In India, you get tax saving under section 80D. So that is quite good. Also, you can pay these premiums in EMI. So let's say for you to take it for your parents, so usually they will be a little higher, right? The premiums will be a little higher. So you can actually take, you don't have to pay in single shot. You can give it an EMI option, right? So a lot of things are taken care of. So it has different benefits, right? So different insurance policies have different benefits. So some of them are pre-hospitalization. So some of these policies takes more care of pre and post hospitalization, right? So you should be careful or mindful for certain things when you take in health insurance policies. What are they? So the waiting period first of all. So what is the waiting period? So some of the insurance policies, certain diseases, pre-existing diseases are not covered in certain policies for let's say 3 years or so. So if you think that your risk is higher, so maybe you pay an extra premium and reduce your waiting period from 3 years to 1 year. That is what I've done for my mom. So she is a diabetic and she has high BP. So I had actually taken it from 3 year waiting period to 1 year waiting period, paying an extra premium, right? Also, you should know that what is actually not covered in insurance policy. So certain insurance policies, OPD is covered, right? So that is basically when you go to a doctor and see the visits are also covered, right? But certain policies don't cover that. They would only cover if you have 24-hour hospitalization, right? So these are certain things you should be careful of when you think about buying an insurance policy, right? So also you should kind of think about there are two kinds of things, right? There are also schemes like cashless, where you actually just go with a card, with the insurance card, and they you don't have to pay upfront fees. And also some of them are co-payment scheme, right? You pay 20% and the insurance company takes care of 80%. So there are different kinds of policies. And one thing I also want to touch upon is little bit different is there are two kinds of policies which you see. So if you are employed with a company, right, they would have their that's called corporate policies, and then which you buy from let's say another private firm, then that's your individual policies. So how corporate policies are different from individual policies are, I would say that what I have noticed the major difference is corporate policies don't have waiting period. So I mean, if you think that 3 years waiting period is too much for you, and you just taken a policy right now, maybe a corporate policy will be great for you. So also you should see the TPA, the third party thing, right? I mean, who actually is the insurer in a corporate, right? So how much network of hospitals they cover. Some of the insurance companies have a lot of network hospitals. So maybe the place where you stay. So if the TPA, the insurer doesn't have any network hospital there, maybe that insurance policy is not suitable for you. So you should also think about the network hospitals which which your insurance firm is covering. So a lot of things has to be taken care of. So I feel the information I cannot give you complete information in just one blog. So I encourage you to do your own research, but I think I would just want to encourage you to learn more about health insurance. And if you're not got it yet, irrespective of your age, you should think about getting it for yourself and of course your loved ones, your parents. Thank you.